Today's tips for physical therapists from prosthetists. Guarding. Guarding in relationship to a prosthesis is almost always going to be where on their prosthetic side, their arm's going to be right down by their side and they will not be swinging it. Now, here's where we need you to do a little investigation. Because chances are there's been a lot of trouble and trauma leading up to that amputation and now their prosthesis. Chances are they're not real secure yet. So frequently, and this is just a habit, there's nothing that's actually driving their guarding behavior. So, arm swing. See if you can just work on their arm swing. See if you can just get them to start swinging their arms naturally. Encourage them to continue to do it. Super important. And if they fairly quickly adapt to that, you're probably okay. They may not. So, if they continue to want to keep that hand down by their prosthesis, how's their muscle strength? You see, a lot of patients, if they have significant weaknesses, imagine they're a trans tib with their quadriceps and or their hip extensors, or if they're trans fem with their hip extensors, then they'll use that hand down by the prosthesis as an emergency catch if they feel they can't stand on that prosthesis. So you may just need to make sure that you're working on strengthening them appropriately so they have the confidence to stand and walk on that prosthesis, and then breaking them of the habit and getting them back to swinging their arms. Also, sometimes that guarding behavior is going to be for a reason. For example, if they're a transfemoral prosthetic patient and their alignment isn't completely appropriate, then that knee may not be as safe as it should be. And so they might have the strength, but they're having a hard time controlling the knee because the knee alignment isn't right. And so they'll use that hand to guard against that knee flexing when they got weight on it. So it's one extra thing that can help them save themselves. And wow, if that's going on, yes, you need to get the prosthetist in there and make sure that gets changed. Finally, sometimes guarding behavior is because of some type of discomfort when it comes to the socket itself. And so they will feel as if they can help protect against that discomfort, or it might be a muscle spasm because they haven't been using those muscles in some time. So they might be guarding against that pain and that discomfort or those muscle spasms. And if it's just muscle spasms, got to get them walking. But if there is a socket discomfort or a pain, and once you ask and start the conversation, hey, why are you holding that arm down there? You may discover that. Again, that's a time to get your prosthetist in to evaluate. So, hope that helps. Would love to hear your comments. Wish you well.